Hi, my name is Celeste. Today I'm presenting a proposed health food access grant program to expand nutritious food options in California's low-income communities. The problem is that California produces nearly half of the nation's fruit and vegetables, but more than 1 in 5 Californians, about 8.8 million, currently struggle with food insecurity. So poor diets lead to chronic illnesses such as heart disease, type 2 diabetes, and obesity. Some of these causes are due to food deserts, which are neighborhoods without full-service grocery stores, poverty and high food costs, limited public transportation to reach stores. So my policy proposal, followed by SMART, is to create a California Healthy Food Access Grant Program, providing financial support to open and expand grocery stores, farmers markets, and mobile produce trucks in underserved neighborhoods. The measure is to expand on at least 50 new healthy food outlets statewide within 3 years of this program, with at least 80% meeting state nutrition standards for fresh produce availability. We are trying to build on existing models like Pennsylvania's Fresh Food Financing Initiative and California's own Healthy Stores for a Healthy Community program. This is relevant because it directly addresses food insecurity, key information on chronic diseases in low-income urban and rural areas, while promoting economic development and also job creation. The time would be that this program launched by January 2026, and there's an evaluation midpoint in 2027, and a full implementation with outcome reporting by December 2028. Underserved neighborhoods are so a neighborhood qualifies as underserved if it meets both of these criteria. So low income, which is median household income is less than 80% of the area median income. Low access, which is at least 500 people or 33% of residents live more than 1 mile from a supermarket in urban areas or more than 10 miles in a rural area. As for funding, the sources are California State General Fund, the federal USDA Healthy Food Financing Initiative, matching funds, and the budget estimate would be $50 million over 3 years for grants and $10 million for tax incentives. Rural and urban adaptation would be urban areas incentives or small format grocery stores, pop-up markets, and mobile produce trucks. As for rural areas, it'd be support for co-ops, regional distribution hubs, and community gardens with retail outlets. This ensures flexible grant guidelines that adapts to the population density and infrastructure. So flexible grants are needed in order to fit the community's needs. The stakeholder support, which the advocate is California Food Policy Advocates, will provide policy research, coalition building, and legislative testimony. The policy champion is Senator Melissa Hurtado, represents agricultural Central Valley, history of food access legislation. So on her website, that describes her. It states that various pieces of legislation addresses her concerns that due to climate change and drought, California and beyond will start to experience disruptions in the food chain, which may lead to food insecurity. Advocacy strategy. So the main activity is a Healthy Access for All campaign, which is statewide press conference and public testimony at Senate Health Committee. The resources needed are fact sheets, community stories, media coverage, partnerships, volunteers for mobilization. The barrier is that budget concerns in legislator. The solution is that it presents data on long-term healthcare savings from improved nutrition and leverage matching federal funds. As for my closing note, I would just like to say that this program will reduce food insecurity, improve health, and strengthen local economies. So my call to action is to let's all invest in healthier, stronger communities by ensuring every Californian has access to nutritious foods. Thank you.